Great. Well, thank you, Vinny, for that great introduction. And it's a pleasure to speak to you all today about reimagining your health, lessons learned, and the journey forward. I wanted to start with a land acknowledgement. We honor the sovereignty of the Ramaytush Ohlone tribe and their descendants, who are the original inhabitants of this beautiful land we now inhabit, which is called San Francisco. I thought it appropriate to start with my own journey to integrative health. I was born and raised in Peru in a medical family, and part of Peruvian culture is our Inca culture that we are very proud of. And part of that also, there is a lot of shamanism and herbalism, which is part of the native culture. Growing up, I always felt that our culture was beautiful, but that the whole idea of herbalism and shamanism, while very cool, was probably outdated and archaic and not very useful. Then in the 1980s, we had, unfortunately, terrorism in our country by the Shining Path, which was a Maoist terrorist group. And after many years, it eventually forced us to move out of our country and into the United States. We settled in California, and in 1992, I was in undergraduate college. I took a sabbatical year to go back to Peru, where I lived in this beautiful area here, which is called the Andes and Cusco. And there I was in charge of taking care of many children who had been left orphaned by the war. And I noticed how poor the access to healthcare was there. There would not be doctors for many, many miles, no urgent care centers often. And the doctors who were available were very overwhelmed. And so many natives did return and turned to shamanism and herbalism as part of their healthcare. While I was in Peru, I did witness the death of one of my charges. The boy had a fever, and I didn't know what to do, and I couldn't get him access to medical care. And so when that boy died, I was faced with my own ignorance, and that determined my fate. I decided I would go to medical school and learn how to treat illness. I went into allopathic medicine and graduated in time to join Tufts New England Medicine, the residency program in 2001, just in time for 9/11 attacks to happen in Boston. I survived, and subsequently I became a hospitalist back in California. And between the years of 2010, 2017, I was recruited to work in the bone marrow transplant service as a hospitalist. I was very privileged to see several innovations in cancer care while I was there. One of the most important ones was the discovery of ATRA. And this is a chemotherapy that uses high dose vitamin A and arsenic, which is a very old mineral used since medieval times for rheumatism and rheumatic disorders. So high dose vitamin A and arsenic were used to treat a very lethal form of leukemia that was called APML, acute promyelocytic leukemia. This leukemia was very deadly, and it killed very young people. And the fact that natural agents were able to transform a chemotherapy that was almost universally fatal into one where doctors for the first time were saying was a highly curable form of cancer. And if you know cancer doctors, they never say cure, they always say remission. That was very, very impactful for me. In addition, I was witness to a new type of treatment called CAR T, and that stands for chimeric antigen receptor therapy. This is a type of immunotherapy where your own T cells, which are part of your immune system, they are trained to target cancer. So I was very privileged to see these innovations. And at the same time, I started noticing that many of our cancer therapies actually were highly purified extract from plants. So this beautiful picture in the middle shows us the periwinkle flower. And that flower has given us vinca alkaloids like vinblastine and vincristine, very powerful chemotherapy, life-saving agents. The yew tree has given us docetaxel and paclitaxel. Mustard seed have given us nitrogen mustards, which were used to treat lymphoma in the 1940s. And it's powerful enough that it was even used as a biochemical weapon during World War I and was subsequently banned. And you have a picture of mustard seeds there on the left. The mayapple plant root gave us etoposide. And as you see there, arsenic vitamin A gave us a treatment for promyelocytic leukemia. And numerous other plants have given us medications that we use every day in medicine, like willow bark gave us aspirin and foxglove gave us digitalis used in heart disease. So a tiny seed was planted in my brain, a mustard seed, if you will. And there are even biblical references that the mustard seed is the tiniest of all seeds, and it becomes the largest of all plants or the largest of all trees. And something like that was happening in my brain where I thought, can the power of plants reverse chronic illness and promote health? And can we recruit our own immune system to fight off disease? That led me to a fellowship at Osher Center for Integrative Health at UCSF, where I was fortunate to meet Donald Abrams, and he taught me everything I know about integrative oncology. Together, we worked on some handouts for patients, and I found that the answer is yes, yes, 1,000 times yes. EPA and DHA, which come from ocean fish, they grant us powerful anti-inflammatory agents that are really good for our immune system. Turmeric and curcumin. Turmeric gives us the active compound, which is curcumin. That is a powerful anti-inflammatory. Vitamin D gives us cholecalciferol, which is not only an important mood booster, but very important for our immune system and to decrease inflammation. Green tea gives us ECGC and L-theanine, which are powerful antioxidants. And the mushrooms, including turkey tail, shiitake, reishi, and cordyceps, have numerous polysaccharides, lenthanins, beta-glucans, terpenoids, and cordycepin, all very important for immune modulation and very, very great for helping people to fight cancer. Cruciferous vegetables give us sulforaphane and indole-3-carbinols, also with great anti-inflammatory and anti-cancer properties. Those are the references for that slide. Notice that all of these chemicals are actually foods. So the power of combining the proper diet with mindful use of supplements is not just additive, but it's synergistic, and it can be very, very powerful. Generally, I recommend that patients avoid toxic foods like sugar, alcohol, processed foods, genetically modified organisms, and dairy, and increase their use of plant superfoods like cruciferous vegetables, omega-3 fish, nuts and seeds, spices, organic berries, cooked mushrooms, etc. It is important to note that diet is not a one-size-fits-all approach. There are some personalizations that need to be made. Patients who have autoimmunity benefit from a more anti-inflammatory autoimmune diet, which is a gluten-free version. Some patients who have mast cell activation or severe histamine disorders may benefit from a low histamine diet. Patients with IBS may benefit from a low FODMAP diet. So a personalized approach is needed, and sometimes even some trial and error is needed as well. I do teach patients about the Dirty Dozen and the Clean 15. And this slide from ewg.org notices that many of the foods that need to be avoided or bought organic, if at all possible, are going to be fruits and vegetables that have thin skins that are kind of difficult to peel. So for example, apples, strawberries are better to buy organic. However, as our excellent registered dietitian, Danica Cowan, mentions, a conventional apple is still going to be better than an organic cookie. And if you can't buy organic, it's just important to note that these have more agrotoxins and they need to be carefully washed or potentially peeled as in apples. Now, it's also important to know where your foods come from. Whole foods come from nature, the way they are. Minimally processed foods are going to come from a kitchen, for example, pasta. Processed foods come from a factory. That would include most packaged foods. And ultra-processed foods will come from a lab. So, for example, Fruit Loops. At UCSF, we have seen an increase in the use of integrative medicine, and this is worldwide. The increase of use for integrative medicine does match the increase in research from our colleagues. Over the last 9 years, from 2012 to 2021, integrative medicine research publications have doubled from about 30,000 to 60,000. And from 2002 through 2022, the use of yoga, meditation, massage therapy have experienced significant growth. Approximately 30% of US adults seek some form of integrative medicine. And the top reasons for seeking integrative medicine include things like cancer, pain, fatigue, autoimmunity, stress, or anxiety and depression. The top reason mentioned by patients is to improve health and wellness. Because I am also an integrative oncologist, the characteristics of cancer patients seeking integrative medicine include comorbid symptoms like chronic pain, fatigue, and insomnia. And perceived stress was significantly associated with depression, fatigue, pain, and decreased quality of life. This is from a study that included almost 4,000 patients with a mean age of 55 years. The majority of patients who seek integrative medicine are white and female, and many of them are very well educated and are reading a lot of the online journals. Because I'm also a generalist, the general integrative medicine patient characteristics include malaise, fatigue, myalgia, mood, IBS symptoms. Those are the most common reasons why patients come to a medical practice. 25% of patients have multiple comorbid conditions. Therefore, we do see an increased complexity in integrative medicine in academic centers. In fact, we sometimes have patients who have no clear medical diagnosis. So those are your mystery patients. And as you can imagine, with the increased complexity, oftentimes patients have seen 10 to 20 providers before coming to an integrative practice. And there is an increased burden of medical-related trauma by the time patients see an integrative medicine practitioner. By this time, I was seeing a lot of chronic fatigue syndrome in addition to the cancer patients. And I like to simplify things in my brain so I can store different bits of information in the brain. And I came up with this 4-bucket framework for chronic conditions and chronic illnesses. Most chronic conditions can be addressed in a holistic way that addresses all of these buckets. So top and foremost is bucket number 1, which is inflammation. And I like to say inflammation is inflammation with a big I, because it's a big bucket. Now, most people think inflammation is one thing, but inflammation is actually many things. Classic inflammation is what we get when our joints are inflamed, when we're having a fever and we feel very achy. But histamine-mediated inflammatory disorders are a big reason why people feel chronic fatigue syndromes. Autoimmune inflammation is another reason why people seek integrative care. Gastrointestinal inflammation, such as inflammatory bowel disease or irritable bowel, are another reason. And neuroinflammation is common as well. Another big bucket is toxic burden on the body. This is becoming increasingly prevalent as modern society becomes more and more industrialized. Nutrient deficits are really important to correct because there are a lot of nutrients that your mitochondria needs to produce energy. And one very, very common one, for example, is iron deficiency in women or in people with gut disorders. And stress physiology is very important to address as well. Now, interestingly enough, systemic inflammation does increase stress physiology in the brain. And then brain stress physiology feeds back into an inflammatory loop. And this looped cycle can be very hard to break. So that's why it's important to address the mind, body, but also to address all of these other buckets to heal the human frame. So by now, I'm using my 4-bucket theory to help patients with chronic fatigue syndromes. And in 2020, enter the coronavirus pandemic. It wouldn't be long before I started having referrals for chronic fatigue syndrome after long COVID, or after a COVID infection, otherwise known as long COVID. I published a book in 2022 on a holistic long COVID approach where patients can have a path to recovery with things they can do at home, like taking supplements and changing their diet. And subsequently, I was asked to be the director of the long COVID clinic at UCSF. And then suddenly I had 250 referrals and a very large patient waiting list. So we created group medical visits for post-viral recovery for long COVID patients. And I used my 4-bucket framework in order to create the curriculum for the group medical visits. So during these group medical visits, we addressed the 4 buckets. And the other thing that the COVID pandemic fueled was increased research into causes of chronic fatigue syndromes, including long COVID. We now know that inflammation is one of the key drivers of long COVID. There are several articles in that nature. There is a 2025 article that showed that low-grade inflammation in long COVID syndrome is associated with sustained platelet activation, and that can cause a lot of respiratory symptoms. There is another publication from 2023 that categorized persistent proteins into different inflammatory subcategories of long COVID. And in this article, it showed that about 60% of patients with long COVID had persistent inflammation in different categorical buckets. In terms of toxins, the need for detoxification is becoming increasingly evident. In 2000, the EPA enlisted the phasing out of PFOs, or known as perfluoroalkyls, in industry. And when that happened, we did see that there was a drop in these PFOAs in human urine and serum. Despite that, industry has exchanged those PFOs for other environmental toxins that haven't yet been clinically studied. So it's really, really important, and I counsel patients to start cleaning up their environment and their own food to prevent these toxins from entering their body. One really easy thing that you can do is avoid plastic containers. So, for example, I ban my patients from using plastic water bottle. They want to use either glass or stainless steel bottles. You also don't want to microwave your food in a plastic container. It's important to look at the home environment and to look at what kind of household products you're using. Avoid ammonia-based products. It's also important to look at whether or not there's water damage in your building and to remediate that. Obvious, but needs to be said, decrease alcohol use and decrease any smoking or eliminate smoking if possible. It's also important to note that those who are aged greater than 50, that there's decreased filtration of these toxins by both the kidney and the liver. And so it's even more important that you clean up your diet if you're approaching middle age. And of course, infection like getting COVID or pneumonia and its resolution creates reactive oxidative stress and what's called DAMPs, or damage-associated molecular patterns. And these increase toxic burden in the body that has already been dealing with all of these other environmental toxins. So to counter these insults, it's very important to decrease exposure to toxins and to increase the intake of antioxidants. The CDC has already shared data that there's sufficient evidence of an association of several of these PFOAs in raising cholesterol levels, in decreasing birth weight, in lowering antibody responses, and so changing immunity. There's evidence in certain types of cancers, in hypertension in pregnant patients, in preeclampsia, and even in changes in liver enzymes, although that evidence is more limited. So in addition to the environmental toxins, we also know that glyphosates are causing a lot of intestinal damage, increase in gut dysbiosis and IBS, and it also can change behavior in the brain because, after all, the gut and the brain are connected. And as we noted before, IBS is a very common reason for seeking out integrative medicine. Glyphosates can degrade gut barrier integrity, therefore increasing the risk of what we call leaky gut and the risk of IBS. And there is also some reason to be concerned about a lot of these environmental toxins on thyroid, breast cancer, and ulcerative colitis, although more studies are needed. So I hope you understand now that toxins are very important. It's also really important to support your body with the right nutrients. And many of you may have fallen asleep during this class when your teacher told you about the citric acid cycle. I hope I'll make it a little bit more exciting. We generally get energy from fatty acids, carbs, carbohydrates, and proteins. And these get broken down into acetyl-CoA, which then gets fed into this little citric acid cycle, which gives you energy. And then those products get fed into your mitochondria for more energy. But notice here, fats need magnesium and B2 to be broken down into acetyl-CoA. Carbohydrates need magnesium and B2 for the same reason. And if you look here at the citric acid cycle, you see that iron and glutathione are important. Again, here's iron and glutathione, magnesium, magnesium B2, iron B2, and B3. So you get a sense that these nutrients are really important. Magnesium, either glycinated or threonate, riboflavin, B1, B3, iron bisglycinate, especially in women, glutathione or N-acetylcysteine, its precursor, and L-carnitine, if low, B2, because there is a carnitine shuttle that shuttles fats directly into the mitochondria, and it also needs B2. So B2 is very, very important. In fact, iron is so important that the World Health Organization has recommended that patients with inflammation be screened by checking a ferritin level, and anything below 70 should be called iron deficient. Those patients should get iron recommended, and the ideal is 70 to 100. Lastly, the last bucket, but not least, is stress physiology. I like to talk to my patients about the vagus. The vagus is cranial nerve 10, and it's a really important nerve because it is the longest nerve in our body, and it leaves the brain and it connects to a lot of organs along the way, the heart, the lungs, the diaphragm, the gut, and it acts as a pacemaker, and it's also anti-inflammatory for the body. Now, the vagus exerts both pacemaking and anti-inflammatory effects, but it's also quite sensitive to the kinds of high inflammation that COVID causes. And there is evidence of vagal dysfunction after getting COVID. Fortunately, because it connects to so many organs, it's very easy to rehabilitate the vagus with vagatonia. And so the vagal afferent branches, they have stretch receptors, which means that a diaphragmatic breath technique like the 4-7-8 breath or box breathing is a great way to rehabilitate the vagus. Acupuncture has several vagal points, including some in the ear. Meditation, mindfulness, guided imagery are all wonderful for the vagus. And even singing in lower tones, like singing Om, can be very good for vagal activation and very relaxing. Movement meditation like Tai Chi and Qigong can be incredibly relaxing. Addressing sleep, pacing yourself, and even there's some early evidence now on neuromodulation as being very helpful. So with all of that information, we created a group medical visit for long COVID patients, and we wove over this whole curriculum in 3 visits. We allow about 10 to 11 patients per group. And the wonderful thing about group medical visits is it allows for built-in peer support and validation, as well as education. The idea is to give patients empowerment through actionable steps so they can take charge of their health. So the workflow is patients come in and we get some labs. I assign a specific anti-inflammatory diet. We'll assign a battery of supplements, and we'll teach mind-body practices in the series of 3 visits. These are the labs that we get for the group visits. So we do an inflammatory workup. We also check for platelet activation, Epstein-Barr virus reactivation. We check for inflammatory cytokines, and we check for that very important ferritin and riboflavin, which is all over the mitochondria. The beauty of this is the labs are covered by most insurance plans. They are fasting labs. And for tryptase and histamine, I ask patients to hold any antihistamines for 7 days. There's also some early evidence on transvagal nerve stimulation as being very, very helpful for long COVID symptoms. And there's various different tools that have been studied. And there's some early evidence and early articles on this but the NIH is studying that more, so we'll have more information to come. There's even some early evidence that stellate ganglionic blocks can be very helpful for long COVID symptoms, and the NIH is going to be studying this soon as well. For the work, we have seen about 200 plus patients over the last 2 years, and patients have really enjoyed the group medical visit series. And we were fortunate to win an interprofessional collaborative award at UCSF, as well as an NIH AHRQ grant to research this further. And it all goes to say that success does require interprofessional collaboration. Our wonderful Osher team schedules patients, gives them calls, answers questions, enters labs. They do a lot of background work, so you need a lot of collaboration to make these GMVs work. And the optimal team has physical therapy rehab and a lot of collaboration between the pulmonary department and Osher. So the ratings of the optimal GMVs have been quite high. Patients really have enjoyed the experience, and they even felt they had time to ask questions, even though it was in a group setting. And the comments, the personal comments that patients have sent are really something that just warms the heart. Patients expressed a lot of gratitude, and this patient expressed after many years of suffering and not getting many answers, it really helped fill in the blanks. I saw everyone that was part of the program go from looking like near death to having a glow back in their skin, smiles on their faces by the third appointment. What a blessing. We're finally on our road to true healing, no more Band-Aids. So lessons learned from this GMV and long COVID journey and perhaps the road moving forward. I believe that each person's journey towards integrative health is unique and brings a valuable perspective. It is important to validate the patient's experience and their constellation of symptoms, whether or not their syndrome is known or well-defined. It's important for us as physicians to lead with curiosity and seek to fill our knowledge deficits with learning and more research. It's important to recognize the role of the earth and the environment in chronic illness, especially when it comes to agricultural practices. Gut health is increasingly recognized as impacting human health, and I do think this is going to be the wave of the future. And improving planetary health is good for us humans too. As a matter of fact, the more we take care of an environment, the more our environment can take care of us. This slide is to show the deforestation of the Brazilian forest. And around the time when we started decreasing PFOs in the environment, there was a article published on healthy French adults, almost 1,000 adults, that did RNA sequencing of their microbiome. And what they saw was alpha diversity decreases with intake of processed foods, and there's an increase in harmful proteobacteria. And those are the bacteria that cause IBS. We do know that low microbiome diversity is consistently linked to several increased inflammatory diseases. And in this chart here, we show that the more patients ate cooked vegetables, raw vegetables, eggs, fish, the more their alpha diversity improved. The increased dairy consumption decreased a very good amount of Akkermansia municipula, which is a good probiotic to have. And as we have 10 more bacteria than we have human cells in our body, you bet that they get a vote. They also connect to our brain and to our immune system through the gut-associated lymphoid tissue. So this is very important to note. Of particular interest is the observation that healthy adults from rural societies like New Guinea, Amerindia, Malawi, Tanzania, and the Amazon have much higher gut bacterial richness compared to urban populations in Italy and the US. Similarly, children from rural communities have more diverse gut microbiome. These host-specific differences in gut microbiota may arise from selective pressures, but they may also be due to the habitat. So taking care of our earth and being exposed to more nature really does influence our gut microbiome in a good way. In fact, there was a study done in southern Finland. They took 48 retired couples. Half were from rural areas and half were from an urban area. They had been living there for at least 20 years, and they collected stool samples and did DNA extraction, RNA analysis. And they found that those who lived surrounded by more nature, that there was a direct correlation with the increased number of shrub species and the increased abundance of good bacteria like Faecalibacterium species and Bifidobacterium species. In fact, our visionary, Susan Lynch, from UCSF, and Jennifer Doudna, our Nobel Prize laureate, are turning their attention to editing the microbiome in order to cure illness. They are starting with asthma in children and also targeting ulcerative colitis and autoimmune disease like multiple sclerosis. So more to come there. So going back full circle, I completely take it back. The Incas were genius farmers. They're not at all archaic. They were able to engineer terraces in steep mountains with low oxygen state that were extremely hot during the day and freezing cold temperatures in the evening. And they were able to grow corn, potatoes, and other crops easily, working with the environment instead of against the environment. In fact, these terraces that were carved into stone, they would heat up during the day. And so when night came and there were sub-zero temperatures, the hot stones would keep the crops from developing frost. So that's pretty brilliant. So I've come full circle to completely admire the technology of the Incas. Now, 1950s farmers began using chemical fertilizer, and they started yielding much higher profits and higher yields at that time. And it wouldn't be until a few years later that the soil deteriorated to the point where the crops started dying from different infestations. Then they started adding herbicides and pesticides. By the 1996, a GMO Roundup tolerant crops were introduced so that you could spray all the sprays that you wanted in the world and it wouldn't kill the plant. And it would be a few years later that the EPA starts sounding a concern and alarm for glyphosates being universally found in blood and urine samples in humans. And then in 2023, the CDC started raising concern for its impact in human health and increasing rates in IBS. So we are now living in a time where we are starting to appreciate our environment more, and we are returning to organic farming practices. The more you can support these practices, the more it increases demand for these types of healthy products to be available to us. And as the health of the earth is restored, so is our own. Integrative health, I believe, is an extension of that philosophy, and therefore it is good medicine and good planetary health. In conclusion, the more we can ground ourselves in healthy earth practices, the better we are in terms of human health as well. The gut and the brain are interconnected. Improved mind-body techniques can improve your gut health, but it is a bidirectional relationship. Improved gut health can also improve your brain health. Decreasing environmental toxins through dietary changes helps us, our gut health, and our earth too. Make sure that you use the power of plants to help you heal, and you can correct any nutrient deficits like iron, vitamin D, riboflavin with the help of your care team. And it's also important to find a community. After all, we're all in this together. And the community doesn't have to be a lot of people. It can just be two peers who really understand where you're coming from. Thank you for having me and for allowing me to speak to you today.
Well, thank you, Dr. Kuon, so much for your presentation. I really appreciate how you really tied together a lot of the themes that we talked about today already. Talked about nutrition, mind, body, planetary health, interdisciplinary teams. Really appreciate you bringing all that together.
Yeah, and thank you so much for the honor and privilege of speaking to the Osher Collaborative. It's been a real honor.
Yeah. Well, we were hoping to have a little bit of a conversation now, just to follow up on some of the points that you made in your presentation and kind of hear a little bit more in this sort of informal dialogue way. And one of the questions I was actually hoping you might respond to start is, again, like we were talking about earlier, one of the key themes of the symposium and your presentation is related to the benefits of interdisciplinary teams. And, as I think about that as an important theme, I also kind of called to mind a person that I saw in clinic recently who was experiencing chronic fatigue and had said, I don't want 7,000 appointments to get to the thing that helps.
Mm.
And so I'm curious your thoughts, your experience around what tips do you have to help navigate a healthcare system in which healthcare access is often challenging and can lead to delays in care?
hmm Yeah, I think your experience and maybe mine and that of many integrative providers is that by the time a patient lands in an integrative office and is talking to an integrative physician, they've navigated an average of 10 to 20 potentially specialists and have had the ups and downs of having hopes that this will be the specialist that has some answers for me and maybe being disappointed with their overall outcomes. And so the stakes are really high. By the time a patient sees you, they have doctor fatigue. They may be a little jaded with the medical system. They may have had bad experiences, and you are trying to create a environment that is able to maintain hope for these patients, as well as offer maybe a different vision than what they're used to. And so I think that that is a special situation and a challenging environment that an integrative health practitioner has to navigate. I think with patients, integrative medicine providers provide that sort of different view, that holistic view that is not just looking at an organ system or is not just recommending, one problem, one drug, one receptor,
Yeah.
uh, is looking at the person as a whole. And I think I'm very grateful for having longer appointments because it gives that opportunity to get to know the patient and hear their story and hear their frustrations with their journey and acknowledge that and give them that space. I think that the job of the integrative provider is sometimes to be the glue between all the different systems. And it helps if they're in the same system so that there is interconnectivity and you can read each other's notes and communicate with their providers. But sometimes, you just have to send some faxes and send your reports and try to bring the team together so that everybody is advocating. Sometimes the job is to be an advocate, right? And to bring the team together so that all of the specialists can weigh in and be in agreement with the plan. And I find that I'm doing a lot of that in the background, is communicating with all of the different specialists and say, hey, I just saw your patient and this is what we're thinking of doing it. Is that okay with everyone? And just getting everybody on board. And I think that can lead to a lot of decreased subspecialty sort of compartmentalization, is being that glue that helps the patient navigate. And sometimes I find myself that the best thing I can do is just help the patient navigate the complexity of the system. So counseling them on how to talk to a certain provider, what to expect, what to not to expect from a particular provider.
Yeah. Yeah. Thank you. Yeah, I definitely agree. I think managing and supporting people uh, through the sort of interconnectedness of all the folks that they've seen already is critical. And I actually feel like that's sometimes people will come to the visit be like, I just want somebody to like integrate all my care. I'm like, great, we're integrative medicine. We can support with that, right? Because that's like I feel like that's another perspective of what we do. Um, and I think often like connecting people, from an integrative medicine standpoint, for example, if we're talking about acupuncture as another approach, like how do we call those folks into the team as well, in a way that like doesn't feel overwhelming, but feels sort of like targeted and specific to like to what's important to this person that we're caring for, right? Um, and I think that that's again another role that we can serve on the healthcare team for sure.
Exactly. And I always consider it a sign that we're making progress when patients feel less need to see multiple different specialists and they're happy with just following up with you on a regular basis and then seeing their other providers in intermittent periods for whatever lipid specific questions they may have or cardiovascular, but kind of trusting you. It's a sign of trust when patients want you to sort of be the person that addresses many different questions and not having to be referred. And so I think that when the number of providers actually slims down a bit, then I know I'm doing my job.
Yeah, exactly. Exactly. Yeah, thank you. Thanks, Carla. One of the other questions I think sort of related to this in some ways is, again, often in our integrative medicine clinics, whether it be integrative primary care or integrative like a specialty consult clinic model, we often see folks who have tried a whole lot of different treatments, a lot of different therapies for the chronic symptoms and conditions like we're talking about today in the symposium. From my experience, I feel like there are sometimes a few treatments along the way that folks have felt have been helpful, and not always, but there are quite a few folks that have tried a whole lot of treatments and have not found any benefit at all. Um, and I just love to hear from you. How do you step into that space? Like, how do you approach care for folks that have kind of arrived uh, in this meeting in a clinic setting with you, who have that sort of background?
Yeah, I think that when you meet with the patient, it's really important to get a really good history of everything they have tried that has been helpful and not helpful, and to start there. Obviously, you don't want to repeat what's already been done, that has not been successful. And a really, really good intake and sitting down with the patient, listening to them, letting them just tell you your story. I like to just open up with a general question and say, why don't you go back to the beginning and just tell me everything from the beginning, when you started feeling these symptoms, what you've tried, what's worked, what hasn't worked, and writing all of that down. And that's our starting point, right? And I think that complex patients are a little bit like an onion, and you have to peel back the layers. And so sometimes they've addressed some layers, but others not. And when patients feel heard and they know that you have understood where they're coming from, and you are not just offering the same things that's been offered before, but maybe a new vision. Maybe nobody's looked at gut health and you feel that they're having symptoms, and that's a place that no one's explored that you're going to explore with them, explaining that to them and why it matters, why it's important, is really a great way to begin so that the patient doesn't feel like you're just going to be another provider who's going to do the same that hasn't worked before. But what what I like to explain is that it is peeling layers, and that you need to address all four buckets, and there isn't a one solution. It's not going to be a magic supplement or a magic diet. That you have to address the whole person and look for all of the organ systems that are potentially under stress. And there is, and acknowledging that there's also some trial and error, and that we're both going to learn about that person's biology together. And so I like to tell the patients that even if a therapeutic trial fails, that it's not a complete failure because it's telling me something about your biology that is going to refine my approach moving forward. And so it's information that is going to help me understand your particular blueprint, and your fingerprint of symptoms and how they fit together. So it's being able to give hope in that setting, which patients are pretty fatigued by the time of their care, by the time they come to see me. So that's common.
Yeah.
And
Thank you.
and I have found that patients are incredibly generous at giving a new provider another chance, even after multiple, disappointments. I'm always surprised at the spirit of generosity of patients and being willing to do one more trial, uh, being willing to suspend doubt, and try something and come back and report to me. Mhm.
I'm glad that you noticed that too. I've been so surprised. And people have sometimes seen 20, sometimes 30 different specialists, and here they are coming and talking to us again in the integrative health context. And usually after hearing the story, I say thank you. Thank you for choosing to show up here today to share your story once again to somebody else. And honestly, to me, that actually inspires a sense of hope too, that this person has an innate and intrinsic desire to feel better, and so uh, there's sort of a connection that we can make and like a bridge that we can build together and steps that we can take forward together. Uh, so yeah, I've noticed that as well.
Mm.
I think one of the other, I guess maybe two other things that come up for me, and I'm curious if this question comes up for you in your work too, related to that, is this question about like when the folks just show up in our clinic spaces and have had all these sorts of treatments before. One of the questions I often start with is, when was the last time that you felt well? And it's very interesting. I would say some people know specifically. I would say a lot of folks say, like, I have no idea. I can't even think of the last time that I felt well. And how that then sort of informs me a whole lot of like, what has this person been through in their life, in the medical system, that has led to this moment in time that I'm sitting with them. And I think the other piece that I think you were sort of hinting at too is that perhaps there's a new perspective that we can take with folks. And I often find part of that perspective is the perspective of partnering with people. My sense, and again, this is not for everybody, but my sense is that a lot of folks feel like they're not kind of in the driver's seat in their own care. And so sometimes just asking a question like, what is it that's most important to you right now in your life? Like, what is it that matters most to you? And like starting with that, and then kind of developing conversations about gut health or mind body therapies, right, based on that. And I find that often resonates a lot with people. I don't know if you've noticed that too.
Yeah, completely. And maybe this is an integrative medicine thing, but I find that patients are my teachers oftentimes. By the time they come to see me, they perhaps out of a sense of need have done a lot of research on their own, and they've read even like medical journals, and they have a pretty good sense of what's going on, and they have some very informed questions, and they may not be the right questions, but they have a lot of information and obviously a lot of knowledge about their own body. And so, what's really great about integrative medicine that I love is that it is a partnership. I like to tell patients, I'm the doctor, I'm the specialist in integrative medicine, you're the specialist of your body,
Mhm.
and we're going to partner together. And we're going to learn from successes and from failures, and we're going to refine our approach, and we're a team, right? And one of the things I love, in addition to the fact that patients are really informed by the time they come to see you, is that um, they're also very motivated. And I love that partnership. You're not just somebody who's telling people what to do. A lot of times I might need to convince them to do something. And that's when all of the clinical teaching, I love doing patient teaching, and having those longer appointments really helps too. I couldn't do it in 15 minutes, but showing them here, these articles, this is what I'm thinking because of this article and that. And I'm thinking about doing a trial of, this or that based on these articles, and like just getting them engaged and excited about trying something, and then showing them pictures, data about the mitochondria, why iron, is important because it's everywhere in the mitochondria. So I love having time to do that, and me engaging in some motivational interviewing. Maybe if they're not convinced, being able to like, this is what I'm thinking because of this. What do you think? And then forming that team partnership, meeting with them frequently and having them report on, was it a success or was it a fail? Do we try something else next time? So in the process too, I learned so much about patients. They send me articles, and they tell me what they've heard from other people. Sometimes things I've heard of, and I'm like, no, that doesn't work. Sometimes it's something I've never heard about, and I will look it up and I was like, oh, this is kind of interesting. Maybe I will try this.
Yeah.
So it's really cool to be able to partner with patients that way, and a lot of gratitude for the fact that they are my teachers. They are my greatest teachers, and their ability and willingness to take that journey with their doctor. I think a lot of times patients just want an advocate, somebody on that side who's willing to partner with them in their health journey, and that's really a privilege.
Yeah. Agreed. 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 Thank you. Thanks for sharing that perspective. As you mentioned, this work is a partnership, and as we are part of the partnership as well, I often like to just check in with other clinicians about, like, how is it that we tend to ourselves in the midst of this as well. Especially, today we're talking about folks who have experienced complex chronic health conditions, uh, all operating within a very complex and ever-changing healthcare system. That, I'll just speak for myself, sometimes that can feel a little bit challenging. It can be a little bit challenging. I would say, argue, maybe the systems level piece is especially challenging, more so than the individual care. And so I'm curious, for you, what nourishes you? Like, in the midst of being a part of this partnership, of being a part of kind of all the different things that go into the care that we offer, day to day, moment to moment, uh, how do you nourish yourself in the midst of offering this integrative care?
Yeah, thank you for that really thoughtful and kind question. When I was a fellow in integrative medicine at Osher, my program director encouraged us to explore all avenues of healing. So to get chiropractic work, massage, acupuncture, to learn, join the meditation class. And so I did that. I kind of went on this like experiential tour of all of the integrative methods that I might potentially recommend in the future. And I'm really grateful for joining a meditation class and learning how to meditate, because I am a perfectionist and I probably would have talked myself out of it initially, because I wasn't very good at it initially. And after that, I have integrated that into my morning routine. And I find that the very, very few days where I don't do it because my morning is too rushed, that I do start getting a bit overwhelmed during the day. And then usually I'll do it during lunch. But I almost never not do it because of that, because I take my multivitamins, and then I think I feel like this is my resilience brain multivitamin that gives me the ability to, hang on and stay through and hold space for real complex issues and trauma, throughout the day. So that is one thing that really does nourish me and keep me afloat. And the other thing that nourishes me is the occasional breakthrough. With complex patients, sometimes it's a year of work, and there will be improvements and bits and pieces, but every once in a while there'll be like one thing that like completely changes the person around, and they'll send you a message and say, "Oh my God, I feel amazing." And I get that message, and there's of course like the 30 other complaints where people are like, this doesn't feel good. But you get that one, and I think all I need is like one of those affirmations per day to be like, today's a good day. We're gonna go. So that's what I wake up for every day. So those successes are great.
Mm, wonderful. Thank
Yeah.
you, Carla, for sharing that.
Yeah.
Yeah. Um,
What
so
about you? How do you keep yourself afloat?
thank you for asking. Thank you. I think there are a few different pieces for me. I think one is a Tai Chi practice is a really important part that occurs not every day, but most days of the week. Being outside, going for a run, also nourishes me for sure. Um, I think being with friends and colleagues, and just that sense of community is really that keeps me going for sure. People like-minded, like-hearted in this work together.
Mm,
And I think the people that I get to sit with in clinic too, because on I think I notice sometimes on one hand it can be really challenging because I want folks to feel better. I want everything to be resolved and people to live happy and healthy lives. I wish that so strongly, and so I think that when I don't see that, sometimes I that's a struggle that I feel like tightness in my chest or my throat or just like a strain, right?
mm,
And and at the same time, like you said, like sitting down in a space with somebody in the way that we do, co-creating plans, that's a sacred space. And it can be very, very nourishing as well. I think a lot of folks that, like we're talking about today, folks with chronic conditions, I have the opportunity to know those people really, really well. Because often, especially in my family medicine practice, I'm seeing folks sometimes once a month if there's some really complex, intricate things going on.
mhm.
And I get to know people not just as like the name of their condition or diagnosis, but I think most importantly as like a fellow human being. Um, and often folks will just like start asking me like, how am I doing? How are my children doing? Right? Like,
Yeah.
and those moments, those just little pauses within the conversations that we have fills my cup a lot.
Yeah, for sure.
Yeah.
I love the longitudinal relationships that I get with patients. I came to integrative medicine from hospital medicine, and it would just be like the 15-minute bedside visit and the short stay, and discharging, admitting. And in that short time, I felt the closest to patients, but I always longed to that more extended time to just really sit down and talk to them about their families and how they're doing. And integrative medicine provides that really collaborative, longitudinal relationship where you get to know the name of their new dog and their children graduated and where did they go to, and so you start learning about their trips and how fantastic it was. And I do love that. A lot of my patients, they feel like family friends, and that's really lovely.
Yeah. 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 Thanks, Carla. Agreed. Agreed. Just being mindful of our time, is there anything else you want to share with folks participating in the symposium today before we pause?
Yeah, no, just thank you for the privilege of speaking to the Osher Collaborative. And I know there's a lot of incredible, brilliant people in this space. And it's an honor not just to present, but also to work with these people day to day. And I feel a lot of my own inspiration to try to be better as a physician day to day by seeing what everybody else is doing and just how much how involved they are with their work and how patient-centered their work is. And one of the things that I love about working for UCSF or an academic institution is being inspired by everything that everybody else is doing, and just uh, being glad that I'm in the mix somewhere. That I get to be, a part of this bigger entity that is creating breakthroughs in medicine every day and providing excellent care. So a lot of gratitude to you and to everybody who is here today listening to this conference.
The feeling is mutual. Thank you, Carla.
Thank you, Vinny.
Yeah.